Hello, everyone. Good evening, and thank you for joining Medical Channel Asia's online webinar, Doctor on Call, the Cardiology series. I'm Sin, who will be your MC for tonight. Today's session is the second out of 3 sessions where we have invited 3 doctors over 3 weeks to share more about their expertise concerning the heart. Today's event is proudly organized by Medical Channel Asia, your one-stop solution for Asian health information. Make sure you check out our social media pages. We are also grateful for the support of a few companies that helped make this webinar series happen. Firstly, we have Zoll, whose focus is on providing medical products and software solutions that facilitate life-saving care every day. Some of the more recognizable products of theirs that you might notice and are around you every day will be their AEDs. They have other innovations as well, such as hospital wearable defibrillator, which detects abnormal life-threatening heart rhythms and gives immediate treatment. This device is available in a hospital for those who are warded and may be at risk of cardiac arrest. Every minute matters. Check them out from the site in the chat. Next, we have StratGuys, a digital marketing consultancy that empowers brands to achieve their maximum potential on social media. We thank them for helping us with creating such wonderful posters and collaterals for this event. Then there's also roads.sg, or Respect Others and Drive Safe, an interactive online community where the focus is on road safety, bringing awareness and positive change to all road users. And lastly, SG Healthcare Heroes, an online community which started out as a collection of Singaporeans who wanted to show their support to their healthcare heroes through their illustrations during the start of the COVID-19 pandemic. There are 8,400 people strong now, and feel free to join their cause. With today, we have almost 70 participants dialing in from all across Southeast Asia. Thank you to everyone present, and I'm sure this will be a fruitful and engaging session for everyone. So just before we begin, a little housekeeping. First, if you have any technical difficulties, just type your questions in the chat box on the right. If you don't see it, click on the single speech bubble icon. These questions will be immediately attended to by our technical support team. Second, if you have any questions for Dr. Kua to answer, please feel free to type them in the Q&A box, where it will be answered later on during our Q&A session. To maintain anonymity, do remember to click on the Send Anonymously checkbox before you post your questions. For those of you who are watching it live on Facebook, you can also put in your questions under the comment section. So for the introduction to our special guest and speaker today, she is Dr. Jade Kua, who will be teaching us on how to use an AED to save someone in cardiac arrest. Dr. Jade is a senior consultant in emergency medicine with Woodlands Health and also a visiting consultant at the Children's Emergency in KKH in Singapore. Dr. Jade is also the director of the DARE program, implemented by the Unit of Pre-Hospital Emergency Care under the Ministry of Health, Singapore. It was created with the aims to strengthen responsiveness for medical emergencies and to raise the level of preparedness in our community. An advocate for holistic wellness, Dr. Jade also has a suite of businesses directed at emotional and mental health, including life coaching, writing children books, and a small Peranakan skincare brand. Without further ado, I'll get Dr. Jade to present to us for today. Dr. Jade, please.
Hi, thank you so much for having me this evening. It's my great privilege to be able to share the information I have that will be able to help you to save a life. Please allow me to just share my screen. I'm going to be sharing with y'all about how to save a life of someone who is in cardiac arrest. It all starts with this little program that I've been leading with my team. It's called DARE, and that stands for Dispatcher Assisted First Responder Program. The reason why it's called DARE is because I could spend all night teaching you how to save a life and tell you all the nitty-gritties about what a cardiac arrest is. But if you do not dare to do something, nothing is going to be done. So it's really important to be brave, be curious, learn what to do, and be brave enough to actually do it. This program started in 2014. The DARE program is not more than an hour long. It's a very, very simple hands-on session, and it's designed to familiarize the public on how to recognize that somebody is in a cardiac arrest, how to start CPR in a urban medical setting, like in Singapore, for example. Hands-only CPR is good enough, and how to use an AED. So that's the really important part that we're going to get to later on in my talk. And the reason why this DARE program is particularly important in our country, in Singapore, is because we have a rather low bystander CPR rate, a rather low bystander AED rate. So very few people dare to do something, even if technically they know what to do. So I know everyone's really concerned about the COVID situation, and truly this global pandemic has gone on for a very long time. It's been very, very disruptive to a lot of industries, a lot of lives, and it's caused a lot of depression, people trying to cope with what to do. But the rest of the medical conditions that used to plague our community before COVID occurred are still there, including out-of-hospital cardiac arrest, so a cardiac arrest that occurs in the community. And in fact, this number is growing year on year. So it's really important that whilst we take care of ourselves in terms of the COVID situation, both physically, mentally, and emotionally, that we don't forget also to continue to look after ourselves and our loved ones when it comes to other chronic diseases like diabetes, like high blood pressure, like heart disease. And today we're going to be focusing on cardiac arrest. Still very much a big problem. Why is it that we focus so much on trying to educate lay people, trying to educate bystanders on how to do CPR and use an AED? The reason is because you can make a huge difference to the victim in terms of survival and also for good neurological recovery. That is to say that if nobody does anything until the paramedics arrive, and in Singapore they arrive in about 8 to 12 minutes, or until they get to the hospital for the doctor to get to work on them, and that can be quite a long time, taking into account traffic and all that, the chance of this person surviving is very low. And even if this person were to survive, the neurological outcome is going to be quite poor. Neurological outcome refers to how well their brain works. So if they have a poor neurological outcome, because not enough oxygen was going to their brain during this period of illness, and it is as if they had a really bad stroke, okay, because their brain will have suffered. So when you talk about cardiac arrest, it is not just a disease of the heart, it is also a disease of the brain, of the kidneys, of the rest of the body that is affected when they do not get enough oxygen because the heart had stopped pumping and nobody was helping them to restart that heart by pumping it with chest compressions or using an AED to restart it electrically. So that is why bystander education is so important. That is why we are reaching out to you, lay people, to help the paramedics and help the doctors to save this person's life. Let's look at some numbers. So if there is no CPR and very delayed defibrillation, that means the AED was used very late, then the chances of survival are very low. That's 0 to 2%. And mind you, when we say delayed defibrillation, we're not talking about 10 hours later, we're just talking about 10 minutes later. So if you do nothing and you wait for the ambulance to come, and the ambulance comes in 10 minutes, and only then does the patient receive CPR and AED, then the chances of survival are 0 to 2%. That's quite low, that's quite dismal, okay? If you start CPR early, but you do not start defibrillation until later on, when the paramedics arrive, for example, that survival does increase. That still does increase because of the early CPR, but it's still below 10%. So out of 100 people with cardiac arrest, if you started early CPR and you started defibrillation before they came to the hospital, but not before the paramedics arrived, only 2 to 8 of them will survive. Now, if you start early CPR and early defibrillation at, let's say, minute 7, okay, so that gives you enough time for someone to run to get an AED, to get it to you, for you to hook it up and defibrillate the patient, then that survival is tenfold, increases tenfold, from 0 to 2% to 20%. what does that tell you? It tells you that the person who is very likely to save this victim's life isn't the doctor who's an hour away, isn't the paramedic who's 10 minutes away, it's you, the person who's right there, who can start CPR early by minute 2, who can start defibrillation early, even before 8 minutes. Okay? Right. So I mentioned that DARE stands for Dispatcher Assisted First Responder program. The first responder is the layperson. And I said that it's dispatcher assisted. So who is the dispatcher? The dispatcher is the person that picks up the phone when you call the emergency line. In Singapore, it's 995. So in Singapore, if you notice that someone has collapsed and you need an ambulance, an emergency medical ambulance, you would call this number 995. Now, the thing to remember is that you're not just booking a taxi, you're asking them to dispatch the ambulance over, and you should stay on the line because they might guide you on how to do CPR or whatever other first aid is required for this patient if it wasn't cardiac arrest. So call 995 and stay on the line. The dispatcher will assist you to be a first responder. Okay, that's why DARE, D-A-R-E, stands for Dispatcher Assisted First Responder. The second thing to do that you should expect will happen is that you'll be expected to start CPR. The dispatcher will ask you to push hard and push fast. And if there's an AED available, and there are AEDs in many, many places in Singapore, you'll be expected to use it. It is meant for lay people to use. It's not meant for just paramedics or nurses or doctors. We use a similar but different sort of machine. And the ambulance comes, and then of course we get to work on the patient when they arrive in the emergency room, which is where I work, all the way up to the ICU. So you can see that this is the chain of survival for what the patient with cardiac arrest will go through. And when you start the process of saving that life, you are part of that system. So it's really important that you understand that you are part of a system that saves life. We're not asking you to go it alone. We're not asking you to take legal responsibility on your own. You're doing it as part of a system. And this is what we would like you to do. So the difference between our DARE program in Singapore that we run and the typical certification course that is run, which is something that has been around for a long time, is mainly this. Ours is less than an hour. It's non-certification. Okay, so it's free, essentially. I mean, we used to go to places of worship like churches and mosques and schools and places in the community like and to offices as well to teach people how to do CPR. And that was just something that we would do for free. If you learn those skills and you build up some awareness and you realize actually you really, really want to be part of this community at a more invested level and you want to pay to do a formal certification class, please go ahead and do that. We highly recommend it. Ours is not a replacement. It's just if you didn't have the time to go for a full-on assessment and you didn't have the money to pay for that certification, that we would at least be able to do this for you and we would come to you. Our main messages are, as I said, to call 995 and stay on the line, push hard and push fast, and use an AED. Those are really just the simple messages we want you to walk away from that free 1-hour session with. In a formal certification, they teach you many, many other details, which are very good as well, including what to do if you are using an AED, but there's flammable gas, there's water, there's a fire. If the person is very hairy and you can't stick those pads on, what do you do? So all of those really important details then come into play. And they will spend that time to teach you all of these wonderful things. But for us, it's really quite basic. So that's something that's quite important for you to know. So let me spend a little bit more time talking about the important messages, okay? So to call 995 and stay on the line, what actually happens when you call 995? In Singapore, there's two things that's going to happen. Number one, an ambulance is going to come to you. They usually come between 8 and 12 minutes for emergencies such as cardiac arrest, such as stroke. And in fact, for these time-based emergencies where every minute matters, every minute that the patient doesn't receive any help means a 10% higher chance it's going to die. For things like that, sometimes they'll send a fire biker ahead of time. A fire biker is a paramedic on a motorbike, so he takes maybe about 4 to 6 minutes to get there, so you can get there a little bit earlier. So as this is happening, the dispatcher is going to guide you on how to start CPR, and if you have an AED available, how to use that. So that's what happens when you call 995 in Singapore. The dispatcher will then ask you to start CPR. In an urban medical society like Singapore, chest compressions is enough. Okay, so this is in the context of somebody who was previously, up until he collapsed, and you saw him collapse. So there was oxygen coursing through his body up until his heart suddenly stopped. And in this situation, you don't have to do mouth to mouth. You just have to push hard and push fast. And that existing pool of oxygen in his body will be able to circulate if you pump his heart. Generally, you would be pushing 4 to 6 centimeters deep, and you'd be going at a rate of about 100 to 120 beats per minute. But the dispatcher that's on the phone is going to guide you to do that. So make sure that you have your phone on speaker mode, put it next to the victim's head, and listen to the instruction, and they will count along with you. So you don't have to be afraid that you're going to lose count. And finally, use an AED. So an AED is a wonderful machine. It's made for lay people. There are many, many brands available, and some of them look slightly different one from the other, but there are some functions that are completely the same. One of them is there's an on and off button. It's going to be very obvious. It's the same. It looks exactly like the button that is on your remote control for your air conditioning, for your TV, for everything else. So there's no way you're not going to know which one the on off button is. When you switch it on, there's going to be an automatic audio voice that tells you what to do. If the pads haven't been stuck on, they will tell you to stick the pads on. So just follow the verbal instructions from the audio feedback on the AED, and also look at the pictures. So there are very clear pictures on most AED pads to tell you how to stick them. Some of them are one on the left, one on the right. Some of them are just across, and you just you just put it in the center of the chest, and that cross shape will cover most of the areas. And just follow the instruction. It's in pictures. It's really easy. We teach preschoolers how to do this, and they often are able to figure it out just from listening to the instructions and looking at the pictures. So it's not meant to be complicated. It is for lay people to use. Once you put the pads on and you switch the AED on, the AED will read the electrical rhythm of the victim's heart. So it will tell you whether or not you have to shock the patient. And once again, that shock button is going to be super obvious. You can't miss it. In some instances, it will be red and orange. In some instances, it will glow. So you won't be mixed up about which button you're supposed to be pressing. Like I said, we teach these classes to preschoolers. 4, 5, 6-year-old students can figure out how to do it. As a grown-up, do not be afraid. It is for lay people. It is not meant to be for medical professors to use. Okay, so it will read the rhythm of the heart, and then it will tell you whether or not to shock the patient or whether or not to simply continue CPR. So just follow the instruction and go with the flow. And every 2 minutes, it will read the rhythm of the heart. When it's reading the rhythm of the heart, it will probably ask you to take your hands off so that it can read the rhythm of the heart as it is. And then if it figures, this is a rhythm that needs defibrillation, it will say, please press the shock button. And then you press the shock button, it will tell everyone to stay away so you don't get electrocuted. And then it will deliver the shock, and then you just continue CPR again. Every 2 minutes, this will happen. And you just keep doing that until the ambulance arrives. Okay, so it is automated. Just follow the instruction. Sometimes it will read a rhythm and it will say, well, you shouldn't shock this one, just continue CPR. And that is really one of the major differences between an AED, which is an automated external defibrillator, and a manual defibrillator, which is what I use in my ER. A manual defibrillator, I have to read the rhythm of the heart, and I have to interpret whether I want to shock the patient or I don't shock the patient. The great advantage, of course, is that it's quicker for me. I save that extra 10, 20 seconds. For an automated external defibrillator, it's hands off, wait for them to read the rhythm, wait for them to make a decision and let you know, and that eats up about 10, 20 seconds. So that's really the only difference. But it is, as you can see, the AED is meant for lay people. You don't have to make any decisions. You just have to follow instructions until the paramedics arrive. And that's really the essence of the 3 main messages that we tend to teach in a DARE class. Back in the days before COVID, we used to, as I say, have physical classes so that we would bring these little half body mannequins to you and train our AED sets. But now, because of the COVID situation and safety distancing, it's really impacted on our ability to deliver mass face-to-face training sessions. So we tend to try and do things virtually online. And that's why I'm so grateful for this opportunity to do this lesson through Medical Channel Asia with all of you. This DARE program is something that has won awards. It is also, I just really want to assure you, it is not something that was just thought up by myself on my own, but it's really part of a team, a system. We've got, professors working through various hospitals under with the blessings of the Ministry of Health. That's Professor Marcus Ong. We've also engaged the Ministry of Home Affairs. That's the SCDF, that runs our ambulance and emergency services, and the chief medical officer sits in very, very closely with us. So when we tell you to call 995 and the dispatcher is going to talk to you, that's because we know it for sure. We work really, really tightly with them. And of course, this is the rest of my team, a lovely team of nurses and first aid trainers, and we all work together on this. This is also a lesson that we teach in schools through the Ministry of Education. So it's really it's a legitimate program. And if you do as I've asked, which is to call 995, stay on the line, push hard, push fast, and use an AED, it's legit. This is something that we all will support you in from our system, because a lot of people, sometimes they're afraid, what if something bad happens? What if I break a rib? What if I make a wrong decision? And will I get sued? What if the patient dies anyway? Because I noticed the chances of survival have increased, but it's not 100%. Don't worry about all of those things, because you are doing this as part of the system. This is what we have asked you to do. Okay, so in Singapore, although there is no Good Samaritan law, the legal system is strong enough to be able to support you should the patient not survive, or should something bad happen. We're all in this together. We're all in this together. And that's something very important that I wanted you to know about. This is one of our real life DARE heroes. So a DARE participant, Alaric, this is the gentleman in the center, he had attended our DARE session a couple of years ago. And that's all the CPR training that he had done. He hadn't yet signed up for a formal CPR or AED certification course. So he had merely gone for our DARE session. And his father, this gentleman next to him, had actually collapsed at home. So his mom then called him and said, what should I do? And he told her what he had learned in the DARE session, which is, call 995 and they're going to ask you to start CPR. Please go ahead and do that. And then when he got home, he took over and did the chest compressions until the ambulance arrived. And his father actually managed to survive and left the hospital just 12 days later. So, about 2 weeks, with great recovery. So we're really, really happy when we hear about these real life rescue cases. These victims are definitely rescued by lay people, by the people around them, and the paramedics and the doctors merely provide that support after that. But the life is actually saved by the lay person. So this is something we highly encourage all of you to do. We have many of these wonderful cases in many circumstances, as in this one. The victim is someone that the victim is someone that has collapsed at home or in your office. So sometimes some of the things that people worry about, like what if I learn CPR, but I'm actually learning it for some complete stranger and that person sues me for taking off their shirt and for touching them or something, when you do the CPR. And honestly speaking, most of the time, this is going to happen to someone that someone that you love, someone in your home, someone in your office. Those problems that occur between strangers of different gender, of different cultures, they really don't come up so much. And in instances where it does happen to complete strangers who are jogging side by side in a park, the victims are usually very grateful that someone tried to rescue them. And nobody really ever complains that someone had to remove their shirt to save them or anything like that. So not to worry. So that brings us to the end of my presentation. It's a short presentation, but full of information. If there were any clarifications that you needed, please feel free to ask me. I'm completely open to any questions that you want to pose to me. And that brings me to the end of my presentation. Thank you.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.